The Doctors, where MD meets TV. Doctor, give me the news.
How far would you go to have better sex? Our next guest says the size of her husband's penis caused her so much pain, she actually underwent a special loosening surgery on herself. We're going to take you inside the OR and answer more of your most embarrassing sex questions after the break.
When we were having any kind of relations, it almost feels like my skin is ripping to the point that it was not, for me, bearable.
Too embarrassed to talk to their doctor about painful sex. But when our next guest, Linda, brought it up, her OBGYN, Dr. David Herzog, had a brand new solution. Take a look.
About 6 years ago, I met my husband. We married. We had a great, intimate relation in our lives. Then, after 3 years, I went into menopause. All of a sudden, I started experiencing a lot of pain when we were having any kind of relations. It almost feels like my skin is ripping to the point that it was not, for me, bearable. This was interfering with our relationship. We're young at heart, we're young in mind. I'm 50-something, not 80-something, and I want the whole rest of the package. I don't want to say, well, that's it, now I'm done for the day.
What's happening with you is the opening has lost its elasticity due to the whole menopause thing. I'm going to make the vaginal opening wider, and it's not going to take away from the positive experience because I'm not cutting muscles. All I'm really going to be dealing with is the outside area. What I really need to know is how wide your husband is.
Yeah, I actually measured him.
So this is the circumference.
Right.
I'm going to sculpt this vaginal opening. This is the YAG laser, which has the unique ability of cutting with literally no injury. Does everybody have their laser glasses on? I'm cutting with the laser. There's no bleeding. Almost done. So now it's all very fine suturing. This will last not only for now, but for years to come.
Linda's here today just a few days after her surgery. Welcome to the show, Linda. How are you doing?
I'm actually feeling pretty good. I'm a little sore, but much better than I thought I'd be.
Well, that's so great. And, you know, it's really important to have a good, healthy sex life all throughout the years, you know, because you have a nice relationship with your husband. So, you know, wanting to fix this for painful sex is really important. But there's a lot of different ways to go about it. And this happens a lot in menopause, a lot of times, mostly because of the hormones, because the estrogen, like we were talking about in the normal vagina, it helps to keep those folds, helps to keep it elastic. Again, you can have women use lubricants, vaginal lubricants, even vitamin E, the capsules. You can actually use vaginal estrogen as well before, you know, doing something like a surgery. And the reason that, and I'm using rubber bands here to kind of show you, is that usually the vagina has a lot of elasticity. That's how you can have a whole baby's head come through there, if you think about it. So it's usually elastic like these rubber bands, and it can go back. But what can happen is it can lose that elasticity in menopause, and that's what causes it to sometimes get narrower and smaller. So the vagina, it's sort of like if you don't use it, you lose it. But sometimes it just happens on its own because of the estrogen, the lack of estrogen.
Well, that's exactly how I felt. When I went to Dr. Herzog, I really, truly thought he was going to say to me, you're 55, you're in menopause, sorry, that part of your life is over. And I'm fairly a newlywed. We only married 5.5 years ago. And I truly feel like I found my soulmate in this person after all these years of my life. And we're young at heart.
Now, a lot of people might not believe in the surgery because sometimes there can be complications with that, like scarring and things like that. You know, a lot of times we use estrogen afterwards to keep it nice and pliable afterwards. But when did he say you can get back to...
He told me in 5 weeks I will be like I was 5 years ago when I got married and ready to go. And so we're looking forward to that. We'll take ourselves a mini weekend.
There you go.
Well, thanks to OBGYN Dr. David Herzog from Staten Island, New York. He developed the lateral procedure that you just saw